Now we'll hear from a group called Gardens for Health, and we'll hear from Emily Morrell from Yale, Emma Clippinger from Brown. Please come up and tell us about your big idea.
I'm a senior at Brown University.
We are co-founders and co-directors of a nonprofit organization called Gardens for Health International.
When Marie's husband passed away in 2004, she knew the probable cause. She went to her local health center and tested positive for HIV. She considered the diagnosis a death sentence. But in 2006, life-sustaining HIV drugs became free throughout Rwanda. Marie returned to her local health center to receive treatment. A UN agency had chosen her health center as a site for food aid. With treatment, Marie received a weekly ration, a small bag of corn soy flour from Saudi Arabia, 8 ounces of vegetable oil from the US, and 8 ounces of sugar from Malaysia. But after just 6 months, these rations ended. Marie and her family consumed less. Suddenly, the drugs made Marie exhausted and nauseous. She could no longer work odd jobs to support her family. When Marie's son wound up in the malnutrition ward, Marie stopped her treatment. Stories like Marie's are all too common, seen throughout sub-Saharan Africa.
So as you can see, malnutrition and HIV form a vicious cycle, meaning that each exacerbates the effects of the other. A person with HIV or AIDS requires additional caloric intake, suffers from nutrient malabsorption, and is highly susceptible to weight loss. Malnutrition further enhances these negative effects and contributes to suppression of the body's immune system. Thus, malnutrition increases the severity of the disease itself and promotes disease progression. Malnutrition also undermines the effectiveness of treatment by interfering with normal metabolism and further decreasing nutrient absorption. Unfortunately, most current nutrition interventions fail to address this cycle. For example, food aid. We believe that HIV-positive individuals like Marie require a healthy, long-term, and locally produced source of nutritional support. To that end, the Gardens for Health model employs an integrated 4-component approach consisting of land rights advocacy, provision of improved agricultural inputs, education and training in sustainable agriculture and nutrition, and investment in high-impact, small-scale agribusiness ventures.
Gardens for Health currently works in Rwanda, and I'm going to explain each one of those 4 program components in a bit more detail. So first, we have land advocacy. Gardens for Health provides legal support to informal community groups of HIV-positive individuals, enabling them to become small business cooperatives with bank accounts and bylaws. As part of a small business cooperative, HIV-positive individuals can then lobby their local government for free access to wetlands, which allow for year-round cultivation. Land is arguably Rwanda's most scarce and valuable resource. Rwanda is sub-Saharan Africa's most densely populated country, and 90% of the population relies on subsistence agriculture. But working through the cooperative model allows a particularly vulnerable population to pool their labor and scarce resources. Second, we have the provision of agricultural inputs. The crops you see throughout Rwanda are maize, sorghum, and bananas, and they're easy to grow, they're easy to access, but they're starches with little to no micronutrient value. In an effort to increase micronutrient intake, Gardens for Health provides agricultural inputs, fortified seeds, fruit tree seedlings, locally produced organic manure, and labor-saving tools. Gardens for Health treats this as an in-kind loan. We quantify the total monetary value of this initial investment, and we look for repayment over a period of 2 years. Surplus crops are sold at local markets, and the resulting revenue is far more than anything that these cooperatives had previously produced. The revenue goes towards repaying the initial investment, and also goes towards sustaining the cooperative's agricultural activities. Our program support also includes home gardens for particularly vulnerable individuals. One of our program agronomists oversees this portion of our program, and we do not seek repayment on the initial cost. Third, cooperatives elect members to participate in intensive nutrition training. These members are then salaried by their cooperatives to become peer nutrition counselors, and they visit the more vulnerable members of their cooperative and monitor their health. On the agricultural side, the Gardens for Health agronomists are trained in methods to maximize the productivity of small plots of land. Through a combination of efficient irrigation systems, mulching, crop rotation, and labor sharing, the Gardens for Health gardens are far more productive than any individual's plot of land. The Gardens for Health agronomists also identify individual members in the cooperatives to become agricultural assistants who are once again salaried by their cooperatives to provide assistance to individuals. Lastly, finally, is agribusiness. Gardens for Health emphasizes organizational sustainability, both for the cooperative and for Gardens for Health. We've identified a number of agribusiness, of non-labor intensive agribusiness investments, such as mushroom production, beekeeping, and tomato and greenhouses for tomato production. Market research has shown that these opportunities have the potential to generate a significant source of cooperative income. Gardens for Health will initially partner with the cooperatives, and a portion of the revenue will go towards repaying the initial investment, and a portion of the revenue will go towards sustaining all cooperative activities so that these cooperatives are really viable in the long run.
So now that you've heard about all the components of our program, I want to give you a sense of the impact that we've had so far over just one and a half years with just under $70,000. So we have helped establish 9 legally recognized agricultural cooperatives comprised of over 4,000 HIV-positive individuals and their families. These individuals have gone on to cultivate and harvest 55,000 kilograms of vegetables and fruits, which is about 50 tons. And through the sale of surplus produce, they have raised about $6,500 in cooperative income. And to give you an idea of what that means for this community, most of the individuals with whom we work live on less than $2 a day, so this has a big impact. And lastly, we want to give you a sense of our team in Rwanda. We have 4 incredible staff members. They're all Rwandan. They've all been with us since the very beginning. We have a project manager, 2 agronomists, and a nutritionist. And in addition, a young woman who graduated from Yale last year, a friend of ours, received a year-long fellowship to serve as our sort of volunteer country director in Rwanda, and she's planning on staying there long into the future, we hope. So why is Gardens for Health a healthy investment? First, we have a broad, tangible impact. Gardens for Health employs a revolutionary approach to improve both nutrition and adherence to life-saving drugs with antiretroviral therapy. So while this vicious cycle between malnutrition and HIV/AIDS has been recognized by the international community, we are the first organization to address HIV/AIDS and malnutrition simultaneously through agriculture. Second, Gardens for Health is extremely cost-effective, especially when compared to short-term food aid. We also show that as we expand over time, the cost per beneficiary decreases dramatically. Third, as I mentioned, we place a premium on sustainability across many levels. So our loan repayment scheme enables organizational sustainability. Our exclusive use of organic fertilizer and pesticides, as well as seed-saving techniques, helps ensure agricultural sustainability through improvement of the land. And at a cooperative level, our investments in agribusiness and other income-generating opportunities helps build the capacity of these cooperatives to sustain their own ventures long after Gardens for Health has moved on to work with others. And lastly, I want to emphasize that our program is replicable within Rwanda and we hope elsewhere as well. As I mentioned, our loan repayment scheme enables us to work with other partners. We reinvest that money, enabling us to expand. And additionally, we have several close partnerships with government agencies and other nonprofits within Rwanda, so we're able to scale up within an existing framework. So we ask that you join us in investing in the agricultural productivity, economic success, and long-term health of HIV-positive individuals in Rwanda. Invest in Gardens for Health. Thank you.
Thank you.